Afifah Quraisha. My name is Saraswathy and my groupmates are SARVENA and HANANI. Today we would like to present about our discussion on SWOT analysis, leadership qualities and few similarities between two leaders, which is General Saleh Sulong and Tan Sri Dr. Nur Hisham. As for my part, I would like to present about Tan Sri Dr. Nur Hisham's effort in helping us fight the COVID-19 crisis using the SWOT analysis. So basically, SWOT analysis is an analytical tool that looks at the strengths, weaknesses, opportunities, and threats of situation or possible solutions. Strengths and weaknesses can be categorized as internal factor, and opportunities and threats can be categorized as external factors. From the article given, for strengths, we can tell that Tan Sri Dr. Nur Hisham is a well-trained surgeon, and for second one, we can tell that his speech delivery is smooth and can be easily understood by the public. Okay, for the next part, which is weaknesses, I would say that Tan Sri Dr. Nur Hisham is restless due to handling the crisis. I'm telling this because since he is a 57 years old man, he is working beyond his capability, and that could be a little bit tiring. So yeah. And for the third one is the opportunities. For opportunity part, I would say that he deserves the name, which is Panglima Setia Mahkota Tan Sri, because of all the effort he has put in overcoming the COVID-19 crisis. And for the last, which is threats, I would say that leading through a crisis itself is a threat. So for second one is, I would say that facing the camera and calmly attending the questions from journalists and netizens. I'm telling this because journalists, netizens and reporters would simply shoot questions on a person during an interview or anything. Therefore, the person has to be very mindful when answering the question, which is what Dr. Nur Hisham did. He was very mindful and he answered the question very well. As for the next part is the efficient strategies that has been implemented by Dr. Nur Hisham in overcoming the COVID-19 pandemic. So the first thing first is thermal scanner. Thermal scanner has been fixed to further enhance the detection of fever amongst tourists and locals who are returning from abroad. So the second one is movement control order, which is also known as MCO. So MCO is basically a restriction of movement of people into or out of an area. So the third one is increase the number of hospitals that could treat COVID-19 cases. And the fourth one is setting up a special fund, which is also known as the COVID-19 fund. This thing has been implemented to raise money to be channeled to patients, particularly those who are affected financially due to the quarantine procedure. So the last one is providing sufficient and up-to-date information to the public. So all the information has been sent to public through the major platforms such as official portal of Ministry of Health and KKM, Facebook, and also some Telegram channels.
Assalamualaikum and hi to me, I'm Afifah Quraisha. My name is HANANI binti Sarani. My matrix number is 2220338 from 1TML1. So I'm going to talk about comparison, difference, leadership qualities between Tan Sri Dr. Nur Hisham and Presiden Sadi Sulong. I'm going to talk about what is the leadership style that they had, how the problem solving and the abilities of they, also the qualities of the leadership. So the first I want to tell about Presiden Saleh Sulong. Presiden Saleh Sulong is a special force soldier with an exemplary record of bravery and decisiveness command. Personally, his fault was his honesty, competence, forward-looking nature, and willingness to learn from the past mistake. He also need a political or cultural advisor to keep abreast of the way he operate some problem and crisis that he face. He also adopt an open style of management, encouraging interagency cooperation. What I can see from the case study 1 is he was a patient listener to all who could contribute. So what the leadership style that he had is coaching leadership, where he coaching team members to develop themselves to become better individuals and professionals. So second, I want to tell about Tan Sri Dr. Nur Hisham. Okay, Tan Sri Dr. Nur Hisham is the Malaysian physician and public health specialist who has served as the Director General of Health Malaysia. He also how he prevent the COVID-19 is he do the widespread testing, contact tracing, and quarantine measures. He has also been instrumental in communicating the importance of public health measures such as wearing masks and social distancing to the Malaysian public. What I can see, he has a visionary and pace-setting leadership style. Visionary leadership with bond, inspiring and motivating people to pursue a long-term vision. While pace-setting leadership is focused on performance and result, he lead as a role model for others to follow. Datuk Sri Dr. Nur Hisham leadership style to characterized as data-driven, transparency and compassionate. Dr. Nur Hisham has been widely praised for his transparency and willingness to engage with the public during the pandemic. He also provide regularly update on Malaysia COVID-19 situation through press conference and media social. He has been open about the challenges faced by the healthcare system in responding to the pandemic, which is my sejahtera. That's all from me. Thank you.
Good morning, everyone. I'm Sarvena, daughter of Martin. Based on the task given by ma'am, which is the similarities between two leaders. What I found from both the case study is that the common similarities that both leaders have is that pace-setting leadership, where the Chief of Armed Officers noted that Branch General Saleh Sulong is a successful leader who was one of is one of the one who can able to get along with everyone and build the teams. Whereas based on Dr. Nur Hisham, he is one of the leader who has become the face of COVID-19 updates in the country, has won praises for his wisdom, competency, professionalism, strong leadership, and demeanor. Um, Second leadership qualities that both the leaders share is Brinch generous Saleh Sulong and his team work tirelessly to build bridges with another agentism in order to find the enemy, fix his position, finish the task of breaking back of this dangerous terrorism group attack. Uh, and as for Dr. Nur Isham, the way that he handles the PC and daily updates on the situations, Dr. Nur Hisham and his team is doing an excellent job on this impossible situation, and the cabinet members also give them space and tools for them to work during to break the chain during this COVID-19. Lastly is that affiliative leadership, where Branch General Saleh Sulong, his ability to motivate his team and be driven to uh, ensure victory was theirs is praiseworthy. If it's not, it was a fine, fix and finish, an expert operation that has success written all over it. Where Dr. Nur Hisham is a well-trained surgeon, has been the front line day and night. He's been working and managing the COVID-19 health crisis. Even during the absence of a minister and deputy minister, he plays his role very well, while facing the camera on and off and calmly attending to the questions from the journalism and netizen. I think that's all from me. Thank you.
Audio Jungle.